ICU Chronicles. Last night was a nightmare on the ICU floor. I don't want to work with those people or see that building ever again. It all started when Natasha came in to work late on a very busy evening. This was something that she always did, and we were fed up with it. As a result of her lateness, it made Taylor late for her daughter's recital. That poor girl. Natasha began her rounds as usual, but soon realized what the floor already knew, that it was busy. Natasha had 6 patients compared to the other nurses that only had 5, which is usually not a problem, but this evening proved to be a little bit more challenging for her. She was soon unable to keep up with her hourly rounds. Tiana noticed that Natasha was visibly frazzled, but thought she deserved to be overworked because of her consistent tardiness. Besides, she had 6 patients last week and did just fine. Natasha sensed that the floor had a problem with her, and she did her best to compensate for the lack of assistance because she felt uncomfortable about asking for help. Meanwhile, Dustin, the nursing assistant on the floor, happened to check in on one of Natasha's patients, Mrs. Anderson, and noticed that she was somewhat confused during their conversation. Thought Dustin was her son Michael and thought she was at the Tropicana in Atlantic City. Dustin is usually able to have an in-depth conversation, but today was different. Dustin, being concerned, brought this information to Natasha immediately, explaining that he usually has lively conversation with Mrs. Anderson, but today was different, and he thinks she should check on her. Natasha explains that she checked on Mrs. Anderson and she seemed okay when she saw her, although she was sleeping. Dustin still wants Natasha to check. Natasha decides that she has time to check on one more patient before she makes it back to Mrs. Anderson. Natasha found Mrs. Anderson unresponsive. What were some things missing from this scenario? Teamwork. Tiana knew that Natasha was struggling and she could have been vital in helping. Trust. Dustin trusted that Natasha would check on her patient, and patients trust they will be cared for. Accountability. Natasha should have requested help from her coworkers. Natasha had a duty to her patients, and the team failed because she didn't request assistance. Open and honest communication. Someone should have engaged Natasha on her tardiness, especially if it was a commonly known issue. The difference between work groups and teams. Work groups are collections of individuals who come together for a joint effort, but whose outcomes depend primarily on individual efforts. A team works together collectively to magnify the group's overall results, usually achieving higher results than what any one individual could achieve independently. Work groups. Work groups differ from teams in many respects, most notably in their perceptions of individual responsibilities, levels of authority, approach to work, and accountability. Members rely on individual contributions. Members come together to share information and solve problems to help individuals do their jobs better. Members do not take responsibility for results other than their own. Teams. Members rely on collective contributions. Members come together to solve problems and make decisions to improve the team's work and group performance or outcome. Members share a common purpose and goals and hold themselves mutually accountable for results. Teamwork requires a group of diverse members to focus on a shared purpose and to work together to fulfill that purpose. Each member contributes his or her unique knowledge and skills within a clearly defined scope of responsibility, authority, and accountability. The purpose of healthcare is to care for and serve people who are ill, suffering, giving birth, and dying people who are experiencing profound vulnerability. E.G. Murphy defined teamwork in regards to healthcare as proactively sharing information on behalf of the patient and not allowing conflicts to interfere with work. Challenges in healthcare. Getting past the day-to-day problems, conflicts, and attitudes of its staff members in order to rise to a level of functioning where our collective actions are in line with our care goals. The collective goal of caring can be interpreted by interpersonal conflicts such as dirty looks or miscommunication from individuals on one shift to the next shift. Unaddressed conflicts can degrade into toxic patterns of behavior, which can completely undermine the capacity of teams to provide effective care. In order to reach care goals, groups of individuals must learn to become teams. Tools for successful teams. Developing strategies to articulate our expectations to each other and to create an environment of mutual respect and open, honest communication. A system to identify the different levels of individual and group responsibility and authority. Developing processes that help individuals analyze problems and generate creative solutions. Successfully identifying interpersonal approaches for responding positively and proactively to attitudes and behaviors that might otherwise hinder a positive environment. Identifying strategies and methodologies can assist a group to achieve consensus and to support a common goal, even in the heat of conflict and controversy. The role of leader in teamwork. Team leaders must learn to surrender some control without abandoning individuals, to support individuals without micromanaging them, and to learn new and innovative techniques for keeping the collective vision alive in the whole team. Leaders are active participants in the development of successful teams. Leaders support the development of team members, providing them with the time, education, and skills to address team communication and team issues. Leaders are expected to expand their own skills pertaining to team participation. 3 key aspects of teamwork within the relationship-based care model. 1. The unique nature of healthcare teams, where the patient is at the center of the team, as well as the value of clearly articulating expectations for the responsibilities, authority, and accountability of all individuals in the organization. 2. Understanding and building healthy team relationships along with a practical tool for implementation. The concept of team members as colleagues as the key to building respectful work environment to achieve desired outcomes. 3. The physician-nurse relationship, relating to a collegial work environment and safe, coordinated patient care. The patient at the center of the healthcare team. Healthcare teams exist to care for patients. Healthcare teams incorporate patients and families as the center of its individual structure. A partnership is created among the patient, family, and members of the healthcare team. Patients are treated with respect and dignity, informed of their rights and responsibilities, provided information that affects their care, included in the planning of their care, and supported as primary decision makers in their care. Team members' roles and expectations. The manager. The role of the manager is to acquire, develop, support, and encourage staff members in the delivery of care to patients and families, and to manage the overall resources necessary to provide that care. The manager works with the direct care team for a collegial and supportive foundation. The manager helps team members gain confidence in assuming individual and collective ownership for the overall quality of care. The registered nurse. Registered nurses set the standards for the level and quality of care. Registered nurses establish the primary therapeutic relationships with patients and their families. The registered nurse determines what care is delegated to others and coordinates care with the patient, physician, and other members of the interdisciplinary team. The registered nurse provides leadership to other members of the unit team by articulating expected standards of care. The registered nurse encourages and supports team members and their contributions. Registered nurses have responsibility, authority, and accountability for the provision of nursing care. The LPN, LVN, licensed practical or vocational nurse. The licensed practical licensed vocational nurse is licensed to provide direct care to patients and families under the supervision of a registered nurse. The licensed practical licensed vocational nurse have a partnership with the RN with a mutual understanding of licensure and role requirements. The nursing assistant. The nursing assistant has a critical role in meeting patient and family needs. The nursing assistant's caregiving responsibilities involve highly intimate contact with patients over time, such as hands-on hygienic and comfort care for patients. The nursing assistant's interactions with patients help them to experience a feeling of being cared for with dignity. Nursing assistants have access to a significant amount of information regarding the patient due to their frequent contact with patients. The housekeeping staff care for the patient's surroundings and often have interactions with patients and their families. A clean and aesthetically pleasing environment is extremely important for the patient's healing and recovery. Patients and their families tell us that when the environment is attended to, they have higher confidence that their other needs are also being addressed. The interdisciplinary team. The team refers to departments within the organization that have an indirect or non-clinical impact on patients and families. The work of each person in each department contributes either directly or indirectly to the care of patients and families. Every member of the team touches patients and families in some way during their stay and deserves to be recognized for his or her essential contribution. The makeup of the team is dependent upon the care needs of each patient. The healthcare team can include professionals from pharmacy, pastoral care services, social services, physical therapy, occupational therapy, radiology services, and nutritional services. Relationship management entails teaching team members how to interact with one another and to effectively and respectfully communicate what needs to be done and to deal with people problems as they arise throughout the day. Relationship management potential is achieved by articulating the expectations within the team and how to manage relationships. Articulating expectations about team interactions provides an opportunity for team colleagues to discuss, negotiate, and commit to a common set of ideas and values. Team members are expected to establish and maintain healthy interpersonal relationships with other members. Healthy relationships are characterized by trust, mutual respect, consistent and visible support, and open and honest communication. People have the capacity to learn how to develop and maintain interpersonal relationships. Developing healthy interpersonal relationship means unlearning less healthy patterns of interaction. 4 characteristics that are the foundation of all healthy teams. 1. Trust. The belief that a team can do the job he or she was hired to do. Trustworthy people are able to develop trusting relationships by virtue of their character, how people are accepted and treated with positive regard for who they are, not for what they represent by title, position, or educational level. Consistent and visible support. Team members can count on each other to be there when things are going well and when a mistake occurs. This is reinforced by a mutual commitment to win-win relationships and to learning and growing together. Open and honest communication refers to being direct and truthful. Based on the 3 commandments for effective communication, send the mail to the right address, ask for what you need, and to thine own self be true. Colleagues care for each other. They understand that support, validation, and compassion for each other as people establishes the foundation to care compassionately for patients and families. Colleagues listen to each other. They listen with an authentic and compelling desire to understand each other's perspective. Colleagues listen to learn and to discover new ways to be and work with each other. Colleagues treat each other with respect. They honor each other as fellow human beings with unique life experiences and viewpoints. Colleagues are self-responsible. They understand that to function effectively and interdependently with others, they must take ownership for their choices and behaviors. Colleagues learn from each other. They hold learning as a high and constant value and leverage interactions and experiences to learn and grow together. Mistakes and interpersonal conflicts are viewed as opportunities to learn. The nurse-physician relationship. Although nurses and physicians work in highly interdependent, the 2 disciplines have a long history of education and role socialization that has traditionally lent itself to a parallel and indirect rather than a collaborative and direct way of providing care to patients. The old paradigm. The role socialization in the old hierarchy doctor-nurse game called for nurses to be passive in their interactions with doctors. They were to advocate for patients without being direct or obvious. The goal of the interaction was to safeguard the patients without open disagreement with doctors' orders, and to appear to respect the physician's thinking no matter what. Physicians are not with their patients all day long. Physicians cannot watch over everything that happens in a hospital, nor are they necessarily qualified to do so. Part of this success for patient outcomes is due to the interventions of nurses. Nurses have access to information useful to the physician about how the patient is doing and how the patient is feeling that is not available from anyone else. Physicians have information that would allow the nurses to carry out their roles smoothly and achieve their objectives more completely. When this information is shared and when each does what he or she does best in a coordinated and deliberate manner, the patient can only win. A collaborative model of practice between physicians and nurses requires system-wide commitment to that model and all levels of the organization. It requires an understanding of the old paradigm and a conscious decision to move into the new way of thinking. Doctor and nurse dynamic, comparison of the old rules and the new rules. The old rules, medical care is more important than nursing care. The nurse can help the doctor as long as nobody knows about it, including the doctor. The doctor knows more than the nurse. If the doctor tells the patient what to do and they don't do it, it's the patient's fault. The doctor did his best. Good doctors rarely make mistakes and see to it that others don't either. The new rules. Good healthcare requires both good nursing care and good medical care. The doctor and the nurse are both there to help the patient and communicate directly and openly to accomplish this. Good doctors know more medicine than good nurses. Good nurses know more nursing than good doctors. If a healthcare plan is to be carried out, it must be worked out with the patient's needs and capabilities. Everyone makes mistakes, but open communication between doctors and nurses minimizes them. Movement from the traditional to collaborative model. In order for the physician and nurse to create a care team that will positively impact patient outcomes, they must function as colleagues. Movement from the traditional to the collaborative model requires both physicians and nurses to change their roles and belief patterns. The physician oversees the medical diagnosis and delegates treatment for the patient. The nurse implements these delegated medical functions based on his or her knowledge and critically thinking skills. In addition, the nurse oversees and implements the nursing assessment and plan of care. Neither doctor nor nurse gives the other permission to carry out their designated professional practice. Let us see what happens when they foster teamwork principles. Prior to Natasha arriving to work, Tiana had an open and honest conversation with Natasha about her lateness and how it affects the team and patient care. Natasha promised to do better, and she did. Natasha arrived to work 15 minutes early that day. Taylor was able to leave work on time and provide valuable notes to Natasha about the daily operations, things to watch out for, and the increased workload they were experiencing. She was also able to see her daughter's recital. Aww. Natasha was able to plan accordingly. She asked Tiana if she would be willing to assist her if she needed additional support. Tiana did not hesitate to provide help to her fellow colleague. When Natasha wasn't able to manage her workload, she requested Tiana's assistance, thus making it easier to provide the necessary attention to all the patients. In addition, it equipped the team with the ability to act quickly. Natasha concluded that Mrs. Anderson was septic. She showed signs of mental confusion, low blood pressure, and increased heart rate. Natasha immediately communicated her findings to the doctor, and she was immediately treated. So remember, teamwork does not mean we always agree with each other. It does mean that we support each other, respect each other, and help each other move towards a collective goal.